Sadibuketa kabandike lethu letibuya ngaphandle kwakuleli sisachubeka nalo luhlelo. Asibahlete emakethe sidabuya sithathe idinza batetfu.
Watch local TV on the go with the Eswatini TV app for only 20 emalangeni. Come on. Do the most with Eswatini TV app. Download from Google Play Store or App Store. We're good together.
Everywhere you go, MTN.
Simenze sinemukele sakuvusela nawe losanza kusivulela sitawungena etindzabeni tetfu. Ibutfo letingatsha tesifundza sakaHhohho lisetindvukini lilungela kukhishwa silo inkosi mswati sithathu kutsi lehlele esigodlweni ngabezweni. Loku kwenteka nje ingwenyama ichubekile nekuhola sive engcwaleni lencane esigodlweni ebuhleni.
Sekunetinkhomba letiqinile tekuthi kwenteka noma kunini kusukela manje ukuthi ingwenyama ikhiphele ibutho letingatsha tesifundza sakaHhohho kutsi lehlele endasi esigodlweni engabezweni. Lokhu kutakuze kuphawula kusondzela kulusuku lokugidvwa kwencwala lenkhulu. Ngesikhathi ingwenyama ichubeka nekhola sive ekugidweni kwencwala lencane ngalwesithathu bese iqalile kubonakala ingatsha yesifundza khona esigodlweni. Silo sigidze sisingethwe ngemakhosikati, sisingethwe nangibo bantfu benkhosi, nemhlonishwa nankulu nemabutho ngekwehlukana kwawo, lekiwo kubalwe nelibutho lakhololo lokulibutho lebafundisi. Kubhekeke ukuthi kumenyetelwe ngalokusemthethweni lusuku lwencwala lenkhulu. Noko emaboko lakhethekile ekulibusisa akiyo ingwenyama yemaswati nokusho ukuthi sive sitawatiseka ngemva kokuthi ibusise. Lubika kwetindzaweni ngisandile Makhanye esigodlweni ebuhleni.
Indlovukazi Mhlakazi yachubeka nekuhola emabutho ngekwehlukana kwawo ekugidzeni incwala lencane esigodlweni elitsitsini. Incwala lencane solo ikhomba kuba impumelelo kusukela yaqala.
Incwala lencane solo ichubeka ngelizinga lelisetulu nangempumelelo sibili. Indlovukazi Mhlekazi ihole emabutho ngekwehlukana kwawo ekugidzeni incwala lencane esigodlweni elitsitsini nalomuhla. Indlovukazi Mhlekazi ekugidzeni yona incwala isengethwe ngemakhosikati yesilo inkosi mswati wesithathu, emazinyane, bogogo balondolozi kunye nebamfa benkhosi. Lokhu emalanga sekeme kanjena sekusho kona ukuthi umthwalo sekumele ube sebhokweni engajeni njengoba sekusondzela isikhathi sayo sekusiko lelisekwane. Lokhu kusho ukuthi yonke ingatsha lebuya etigodini totini telive ibheke ukuthi iphelele kude silo inkosimswati wesithathu sitawuyikhokha ukuthi iye kuyawukhalisekwane. Edithapeni kubika Pholile Maziya esigodlweni eLuthithini.
Imfuna yeteklima Jabulani Mabuza inika sive nabalimi itfolo gcina kutsi tikhulumba tahulumende tikhona futhi tanele kusita sive kulimeni event lonke kulesikhathi. Imfuna yithi balimi nabahlangana netinkinga balishayele tiko kude batawusitakala.
Induna yetekulima Jabulani Mabuza ithi tikhulumba tanele lapha eveni balimi batawusitakala ekulinyelweni nathi zilwatoke tikhulumba ukhona kude lokutawuthikameta lohlelo lwekulima.
Tikhulumba tikhona tiningi empeleni setiningi ngembambanyalo ngoba ma-awala amaningi asalinyiwe lasasele mancane kakhulu, so sekuyakhonakala nje nekuthi noma ngabe bakhona labakhala ngesikhulumba bese tiyasuka ke leti mhlawumbe leto leseticedzile kuleyo RDA leti kuyo setiyashulungana tiyoelekelela lapho kunetinkinga ngakhona ngoba timvula tini ngasikhathi esinye tina ngekwehlukahlukana uye ukhanze ukuthi tinile mhlawumbe kahoho lisengakani elibonjeni naseline elibonjeni kanjalo mhlawumbe encenye lisengakani eshiselweni. So ke sibati rotate nje, otherwise dinengi tikhulumba lebe sinato nje lonyaka tingetulu kwa 300 lebe tilimela eMaswati, letinye tahulumende letinye besengeja wona eMaswati ukuthi aseboleke tikhulumba tawo sisebente ngawo. So le nombolo sicabanga ukuthi isibambisile kakhulu ngekwati kwethu kwanyalo kude lapho kushoda khona tikhulumba.
Induna ithi uma balimi badibana netinkinga bangashayela inombolo lethi 7802 0613. Etinzabeni kubika Giyani Msibi naSmuva Shongwe eMbabane.
Umphathi wesikhwama selidlela Ndvongeni Eswatini National Provident Fund umfana Nkosi lonkhokhela somemedele ukukhula kwemali letfolakala umali longala lesikhwama lishonile. Lomphathi uthi uma umuntu washone ngaloko tayelekile sekutawuphuma imali lemalangeni letinkulungwane letisikhombisa nemakhulu lasihlanu kanti nakashone ngengoti kutawuphuma imali letinkulungwane letilishumi temalangeni.
Leti nguquko letinsha letimiyethelwe ngumphathi wesikhwama selidlela Ndvongeni Eswatini National Provident Fund umntwana Nkosi lonkhokhela ngalomasingcwabisane wemalunga alesikhwama selidlela Ndvongeni lokwatiwa ngekuthi siphelele free funeral titawufaka ekhathi bonke labashone kusuka natilunye kulenyanga lesetulu. Lokhu kuvela emcimbeni wekucala umnyaka walesikhwama lobekade ungenelwe ti-70 yalesikhwama. Ibhodi ihlangene na minister ne-cabinet basibusisele lokuthi sale isuka ku-5,000 iya ku-7,500 for normal death and to 15,000 for accidental death. Nangabe sohambele isithobo sakho kufanele ukuthi le claim yendiwe within 6 months. Uma ingendiwa in 6 months sengahle kwenteke kukhanya ukuthi cha sesicabanga ukuthi usho ukuthi umbe bongayidzingi le mali endiphela seyisebentelo kuyo. Labakhulumeti isebenti kulomsebenzi lo kube ngusandile Dlamini kanye namfokodisi Maseko.
I-management yakho Nkosi ibhizi kakhulu nje lonyaka isibukela lenye indzaba lengathi khonyanyana lethenza i-medical aid. Siyazi ukuthi kuyahamba kahle kakhulu Mhluphi ngoba baphathi bekuyasithanza kakhulu.
Elasihambeni ke sibe nalama goals ethu siwa achieve lawo ma goals si celebrate.
Umphathi walesikhwama ukusathe leti sebenta lesikhwama ukuthi athi chamuke nemisebenzi kanye nemabhizinisi lato kwakheka lesikhwama imali. Tindzabeni kubika Fortune Dlangamandla. Mina sikhumbuzo Dlamini sisezulwini.
Lihhovisi leliphini landvunankhulu lecwayisa sive ngekuganga lokuchubekako kulamalanga. Letigangi tenta ngathi tisebenta emahhovisini eliphini landvunankhulu kanti tishayela sona sive tisatise ngemali lekumele siyitfole esikhwameni lesingadange sesibe khona lekuthiwa sikhwama lesibhekene nemkhuhlane COVID-19. Letigangi kuthiwa tiyenga sive ngekuthi yasithumele imininingwane yaso yahamba mali intfo lengekho emthethweni. Lelihhovisi lithi liyatikhweshisa futhi yalithinzani nakancane nalokuganga. Lihhovisi leliphini landvunankhulu lithi kude luhlelo lolunjengalolu loluchutshwa ngilo lelihhovisi kude netinhlelo tahulumende letentiwa ngulelihhovisi letitsengiselwa sive. Lihhovisi leliphini landvunankhulu licela sive ukuthi sicaphele kakhulu kuganga lokunjengaloku kulamalanga futhi akubede umuntu lokhipha umniningwane wakhe awunike bantfu labangatiwa labashayela sona sive tincingo kungaba imininingwane yasebhange hamba mali noma tinombolo tesichaza buve. Lihhovisi lithi sive loku asikucaphele kakhulu. Lestatimende esikhishwa ngumabhalane lomkhulu ehhovisini leliphini landvunankhulu uMelusi Masuku. Litiko letemcebo waphansi nemandla likhathatekile ngekuweswelakala kwapetrol weluhlobo lwe-unleaded petrol 95 etindzaweni letiningi letitsengisa petrol eveni. Ngekusho kwembiko lokhishwa ngumabhalane lomkhulu kulelitiko Dorcas Dlamini, litiko lisicaphele lesimo liphindze linxusa tinkampani ta-oyili ukuthi tikhumbule umgomo wato lomkhulu wekwenta siciniseko sekuthi ipetrol uhlala ukhona kuma-filling stations ato. Ema-filling stations ato. Litiko lithi lesimo sibangwe tinsaya letitsite lapho tinkampani ticupha khona petrol kanye nekuthi ipetrol uyinyama kuletinsuku maningi emagalaji lamtsengisako. Litiko lithi tinkampani ta-oyili litinikile siciniseko sekuthi tenta konke lokusemandleni kulungisa lesimo masinyane ngako-ke sive siyacelwa ukuthi sibeketele. Lisekela lemphathi wenyuvesi yakuleli Professor Justice Twala ukhuthata abafunzi ukuthi lithuba lekufundza abalibambe ngetandla tetimbili kude batawuba nelekusasa lelihle. Twala ukusho lokhu ngesikhathi yachazela abafunzi betifundvo tebunesi labatawufundza kwekucala kule nyuvesi ngekusebenta kanye nenchubo yale nyuvesi.
Lo msebenzi ukwemukelwa kwalabafunzi labatofundza tifundvo tetembili enyuvesi yakuleli University of Eswatini bobanjelwe egatsheni layo laseMbabane. Lisekela lemphathi wenyuvesi Professor Justice Twala uthi tikigaba teludlama tikakatseki kulabafunzi.
We expect all students to take this opportunity afforded to them to learn with both hands, ensuring that staff members, academic, administrative and support staff are accorded the respect, cooperation and common courtesy at all times. University shall not tolerate any form of discrimination, violence and unruly behavior within the learning spaces of the institution.
Labafunzi bathi bakujabulele kakhulu ukutofunzela basebethembisa ukuthi angeke liphupho labo lebunesi life basesenyuvesi.
Commitment yami ukuthi nginake tincwadzi tami like ngavuma ukuthi ngidistracteke lula ngibe focused. I'm very excited ukuqala ngifunze la sayela varsity.
Bese sivile ngayimkhibela into ekakhona la emvasi sesitsheliwe ngako konke kunatha kunenge nje kepha besifisile ukuthi ize sifike ema-open aid njengoba basigathile batala emakhaya ukuthi sophumelela nathi siyafisa kuphumelela.
Labafunzi bacwayise ngekutiphatha kabi nangenela imikhuba lemibi lengababulala ikusasa labo. Zabeni kubika Fortune Dlangamandla inasimuva sho ngesembabane.
Lokhulumela lihhovisi le-King's Office Percy Simelane uthi Kusile liciniso ukuthi kunetinkomo tenkhosi letibulewe esibayeni sato eMpumalanga.
Ngiyabonga kunginikeza lithuba lekuthi silihhovisi sichaze lokuthi Uma sibona la social media labe babhali khona lokuthi kunetingomo letingemashumi lamabili tingwenyama letidutshulwe esibayeni sayo ingwenyama eMpumalanga tahlinzwa batithathela sithike singakaphenduli akeke sesiphenye sacela ke labo lababhoboka labakhona ukuphenya i-intelligence ukuthi ake siseyihlole lenzaba cha yabuya ilambatha ngesiswati kude tinkomo letilahlekile leMpumalanga kude naletitholakale tifile noma timbili nje laba basethi ngemashumi lamabili kude letitholakale esibayeni sengonyama tifile noma ngaphandle kwalesibaya sengonyama eceleni kwemuntu wengonyama kude letitholakale tifile indlunkulu le eMpumalanga emntwini wenkosi kude tinkomo le ine record yato ukuthi tilahlekile noma tibuliwe sethi sike cha asibike emaswatini ukuthi angaphaphuleki ikakhulukazi ngoba bekuthiwa nanyalo kusathiwa ingonyama beyikhona le eMpumalanga natibulawa le esibayeni sayo vele ke lokho kuyethusa ukuthi kepha empeleni bekungafata ingomo tengwenyama ikhona nayo labantu ngabe bebaphokophele kuyofinyelela kuphi.
Emafotsa lamathathu labekwe licala lekutama kubulala kanye nelekulimata impahla lelinganiselwa etinkulungwaneni letingemashumi emalangeni ayaliphika lelicala athi simangali sashaywa sigungu sebantfu hayibona. Lamatfotsa sekafaka isicelo lesiphuthumako sekutokela ngaphandle enkantolo lenkulu.
Ecaleni lecala amatfotsa lamathathu lokunguNkosenhle Fezile Dlamini, Sifiso Felix Dlamini kanye naSithembiso Majaha Dlamini bonke bendzawo yaselembutini kuthiwa lecala lekwetama kubulala Mancoba simelane nekulimata impahla yakhe kuthiwa bawenta nathi 16 enyangeni yeLweti eminyakeni lophelile. Ecaleni lecala lokungilelo lekwetama kubulala simelane kuthiwa laba labathathu balenta mase ibumbeni insimbi yemfica ebusuku khona etimbutini lapho khona kuthiwa ekubambisana betama kubulala Mancoba simelane bekumshaya ngensimbi bamgeca ngabobhusha kanye nangaletinye tilimato bachinge futhi bamkhahlela bamshaya ngedibhakela baphinze bamgangatsa ngematshe emahlandla lamanyente emtimbeni wonke. Ecaleni lesibili abasolwa labathathu kuthiwa balimata impahla yakhe eMancoba lokufaka ekhathi amafridge lamabili emafastelo iwall unit tivalo titofu tekupheka kubala kulokunye lokungabithi imali le-27,600 emalangeni. Emaphepheni ekutokela ngephandle labasolwa labawafake ngembiko lijaji lenkantolo lenkulu John Magagula bathi tena seliteka lelicala ngeke balivume bathi bayamangala ngalamacala lababekwe wona ngoba phela Mancoba washaya sive senza yasetimbutini lebesimsola ngekweba imfuyo lokuyindvo levamile kulendzawo. Bachubeka batisa inkantolo lenkulu ukuthi ngalelanga lahlaselwa ngalo Mancoba bona bebangekho lapho kwenteka khona lobucala ngakho banobufakazi lobunetisako kulelicala lobutakwenta ukuthi lisulwe. Bathi kungimanje bagcine ejele ezakhele labathi ligcwele liyaphuphuma kani besaba ukuthi kungenteka bagcine batfole isifo sesifuba sengadi lesingabangela kugula noma ke ukuthi bagcine bashonile. Ijaji lenkantolo lenkulu John Magagula libanika imvume yokutokela ngephandle letinkulungwane leti-15 emalangeni umsolwa ngamunye wasewuthi ababhadala letinkulungwane letintsatfu emalangeni bese letinkulungwane leti-12 emalangeni kuba sibambiso. Labasolwa bamele ngummeli wabo uMathokoza Mpamalo wenkampani ebameli bakaMpamali ekaManzini. Etindzabeni kubika Fortune Dlangamandla isenkantolo lenkulu.
Kuba khona kwe-braille etikolweni kusita ekutheni bafundzi labakhubateke ngekungaboni emehlweni basheshe bakwati kuyisebentisa. Umhlaba ugubhela usuku lwe-braille ngalesithathu.
Sicubulo salonyaka selusuku lwe-braille sithi kufinyelela kubantu labakhubateke ngekungaboni. I-braille isita kuthi labakhubateke ngekungaboni emehlweni bakhona kufundza nekubhala basebentisa yona-ke i-braille. Nondumiso Shongwe longusihlalo wenhlangano yebantu labakhubateke ngekungaboni kuleli i-Eswatini Association of Visually Impaired Persons i-SAVIP uthi lolu suku lomcoka kakhulu kubo.
sibamlanga bangaboni sijabula kakhulu ikakhulu ngoba siyathi labanye bethu sifundzile labanye bethu basafunda sifundzile nje ukuthi kube khona nangu-Louis Braille lowa inventa lendlela yokubhala nanga emathuthumba lagucuka abe ngemaphethini lahlukahlukene kukhipha inkulumo letsite umuntu ongaboni ukuthi akhone ukufunda njengabo bonke bantfu sinayo nje imishina lematima lekhona kuma-libraries ethu lesiyiphiwe ngito imintenkosi kuye ngayo hulumende wakangwane letenta tintfo tibe lula ukuthi nabani noma ngabe ngiphi i-organization letawusebenzisana nemlo ongaboni akhone kuyowusebenzisa loya mshini ukuthi ende ukuthi umuntu obangaboni naye abe part and parcel walowo msebenzi lakawendako siphinde sabona-ke nasetikolweni ingena imishini ama-embosers etikolweni lufaka ekhathi imbasheni boqinisweni nayo i-St. Joseph's ingena imishini lapho khona kukhicithwa khona i-braille etikolweni yebantfwana ukuthi bakhone kufunda njabo bonke bantfwana lesithi kulamalanga yi-inclusive education.
Le nhlangano kwayibonga uhulumende waseswatini ngakunaka tindzaba tebantfu labangaboni nakuthi i-braille ibe khona etikolweni nebafundzi labakhubateke ngekungaboni bayati emabangeni laphansi. Kubika Giyani Msibi nginasimuva Shongwe letinye tithombe etholakele ku-internet.
Itiko letemphilo lithi kuletikhatsi tekuphitsitela temaholide akhisimusi lelitiko licwaninge tifo letingemashumi 30. Umcwaningi wetifo kulelitiko uvusile kotfwako ukuthi babone kwanza kwemibiko yebantfu labadle kudla lokusesimeni lesingakalungeli kudliwa i-food poisoning kanye nebantfu labalunywe tinyoka.
Itiko letemphilo lithi ngesikhatsi semaholide akhisimusi tiyaye tenyuka tinombolo tetifo netimo tsite pheceleti diseases and conditions letiye tivele. Umcwaningi wetifo etiko letemphilo uvusile kotfwako uthi lelitiko ngenyanga yengongoni licwaninge laphenya tifo netimo letingemashumi 30 leletinyenti tato tichamuke esifundzeni sakaManzini. Lokotfwako uthi ngelibandla le-Rapid Response Team litiko lisebentisa luhlelo lekulandzelela tifo pheceleti Immediate Disease Notification System kulandzelela tifo ngekushesha.
Ngidawukhumbula ukuthi bo-COVID solobakhona solosishumayela indzaba yabo satibona netifo letfaka nekhatsi nemisheko sabona kakhulu most importantly issues around food poisoning. Lokunye uyukhanza ukuthi udlela kudla mhlambe lokungaphephi bese mhlambe kuyakugulisa kubangalela totimbawu. What the team then does, ukuthi nabakubona le facilities letibhedlela basende bashayela ucingo bese le system yethu ka977 isende ama message lama team ayakhona ukuthi bayasa responda ayokhona lokubona lokuthi lokudla yini ngoba kufuna bathathe lokudla basiyobhobola laboratory kufuna sithathe emanti le stuff ke sikhanze so siwabonela ama food poisoning amaningi kakhulu but lokunye lesikubonile lengasho ukuthi kuphakama inombolo letsetulu sibonile ukuthi lokucala hlobo setiyakhula naletithi ema cases ema snake bites bantu labalunywe tinyoka akuchamuki noko mhlambe ku region inye kuchamuka onke ema regions.
Lokotfwa kukhuthatile nekuthi sive siboyetfulela tisebenti tetempilo emtholampilo tonke timpawu taleso sifo kude kutawuba melula kusilandzelela. Etindzabeni te-Eswatini TV kubika Samkelisuye Khoza ngasikhumbuzo Dlamini eMbabane.
Kutemidlalo sihlalo wenhlangano yemidlalo webhola esifundeni sakaHoho Comfort Shongwe ucela emacembu latodlala endzebeni ye-Instacash ukuthi angakophi umoya lomubi ukube seyasusa umsindvo nangabe imiphumela ayikahambi ngendlela bebafise ngayo. Shongwe bekakhulumana kutfonsana emacembu latogcugcuzelana kule midlalo kule mphela-sonto.
Sisaya kule midlalo there are ugly scenes lesitibonile ebholeni tendeka nationally. We are hopeful ukuthi those ones angeke tendeke kulama games ethu siyaqela lokuthi kungendeki. I'm happy ukuthi bo Rafaela bakhona la in our midst and the referees committee nationally they've met and they've reached the smoke peace pipe. Ngicabanga ukuthi konke kutawuhamba ngaba lonina kutaba kuhle ngidawucela ke nasive lokuthi sisibambise ku such endeavors.
The chairman for the Super League on the other side said very clearly that Instacash wants to reach the people. That's why our games are not being moved from where the people are. We'll go to Dimpisine at the Lutheran ground because we want the people there to see us there. We'll go to every single ground in Ho, every single ground in Swaziland. For that purpose, we are trying to get to the people.
28 minutes after 7 sitipesela poti indzaba tethu nomhla ekuseni sitawo saselikhefu nasibuya sizabuya sichubeke sibuye tangephandle kwakuleli. Welcome back. Sakuvusela nalo sanza kusivulela lomhlehleleni Kusile Breakfast Show. Siklesikhathi sithandlelela iclip lapho khona bayenhlangano kamhlaba empilo WHO bahlangene nebedindzaba kusiniketa the latest update on COVID-19, monkeypox kanye naletinye tifo letikhungetse umhlaba.
Good morning, good afternoon and good evening. The dawn of a new year in many countries offers a collective moment for both reflection and ambition for the year ahead. Now, into the fourth year of the pandemic, the world is in a much better place than it was several years ago, due to clinical care management, vaccines, and treatments. For most of last year, COVID-19 was on the decline. Vaccination increased across the world, and there was sustained progress in many low and middle-income countries that had been left far behind in 2021 due to vaccine nationalism and manufacturing capacity being restricted to just a handful of countries. New life-saving antivirals were identified last year, which helped cut mortality further, although the rollout followed a similar pattern of rich countries first. WHO is working, as always, to improve access, and on Christmas Day announced that the antivirals nirmatrelvir and ritonavir were pre-qualified for production by an Indian manufacturer. This is the first generic version of an antiviral to get WHO approval and should lead to increased production and access, particularly in lower and middle-income countries. But despite clear progress, the threat of COVID-19 persists. There are still major inequities in access to testing, treatment, and vaccination, and ultimately COVID-19 remains a dangerous virus to our health, economies, and societies overall. Every week, approximately 10,000 people die of COVID-19 that we are aware of. The true toll is likely much higher. We are really concerned about the current COVID-19 epidemiological picture, with both intense transmission in several parts of the world and a recombinant subvariant spreading quickly. In recent weeks, there has been increasing reports of hospitalization and health system pressure, particularly in temperate regions of the Northern Hemisphere, where respiratory diseases, including flu, are also circulating. In the last week, WHO held a high-level meeting with counterparts in China to discuss the surge in cases and hospitalizations, and subsequently, WHO's Technical Advisory Group on SARS-CoV-2 virus evolution and the COVID-19 Clinical Management Expert Network groups both met with Chinese experts. We continue to ask China for more rapid, regular, reliable data on hospitalizations and deaths, as well as more comprehensive real-time viral sequencing. WHO is concerned about the risk to life in China and has reiterated the importance of vaccination including booster doses to protect against hospitalization, severe disease, and death. This is especially important for older people, those with underlying medical conditions, and others who are at higher risk of severe outcomes. With circulation in China so high and comprehensive data not forthcoming, as I said last week, it's understandable that some countries are taking steps they believe will protect their own citizens. This data is useful to WHO and the world, and we encourage all countries to share it. Data remains essential for WHO to carry out regular, rapid, and robust risk assessments of the current situation and adjust our advice and guidance accordingly. Outside of China, one of the Omicron subvariants originally detected in October 2022 is XBB.1.5, a recombinant of two BA2 sublineages. It's on the increase in Europe and the US and has now been identified in more than 25 countries. WHO is following closely and assessing the risk of this subvariant and will report accordingly. COVID-19 will no doubt still be a major topic of discussion, but I believe and hope that with the right efforts, this will be the year the public health emergency officially ends. In other good news, Ebola in Uganda has not been detected since 27 November. If this holds, there are no cases by 11 January, the outbreak will be declared over. The last years have been tough on our collective health, but I remain confident and steadfast in the belief that only by working together can we harness and share science, deliver solutions that save lives, and build solidarity to counter the health challenges we face. This year also marks the 75th anniversary of WHO's creation, and we will be sharing more in the coming weeks and at the WHO Executive Board about our plans for this historic year. Happy New Year.
I just wanted to get an update on the clinical trial for the vaccines in Uganda. What's been happening over the past few weeks, and how is the fact that there have been no new cases detected since late November impacting those clinical trials? Thank you.
As Dr. Tedros says, the main objective of the Ministry of Health in Uganda of WHO too was to stop the transmission of the outbreak. Outbreaks provide us with a unique opportunity to evaluate the efficacy of candidate vaccines, and working with the researchers in Uganda, the developers, and several partners around the world, we prepare for the implementation of a phase 3 revaccination clinical trial together with aims to evaluate the immunogenicity of the vaccine. As we reported before, the trial was organized, the approvals were available, and it was done in record time, 79 days to be precise. Unfortunately, there are no more cases of Ebola, and so what we are doing in collaboration with all our partners and the scientific community is to looking at 3 aspects. First, what is the best way to proceed with the doses of candidate vaccines that are now available in Uganda in a way that we conduct research that advance our understanding of these vaccines. Number 2, how we can work together with the international community and the developers to ensure that the next time we have an outbreak, we have more data on the safety, immunogenicity, and efficacy of these candidate vaccines so that they could be evaluated more easily in the context of the outbreak, or perhaps deployed with additional data collection. And third, we are also preparing and discussing with the regulatory authorities, both in the countries where these vaccines have been developed, but importantly, in the countries where the vaccines will be deployed. And to achieve this goal, we have organized a consultation on January the 12th, next week on Friday, that is open to everybody, where these points will be considered. I just want to say that it's important for people to bear in mind that when you have a disease with very high mortality, like the Sudan Ebola virus, where about 60% of the people infected could die, and in the context of outbreak, we develop clinical trials, and we have the expertise and the colleagues and the researchers in the ground to conduct trials. If the outbreak is declared, as Dr. Tedros says, over on January the 11th, the challenge for all of us in the international community and WHO is set up to take the lead on that and to help people to move forward, is to advance the evaluation of these vaccines so that the next time we have an outbreak of Sudan Ebola virus, we not only have the candidate vaccines in the vials, but we also have collected collectively as much information as we can on their safety, immunogenicity, and efficacy, so that they can be either in a position to have regulatory authorization or be deployed without incremental requirements in the field.
I think we've taken a huge step forward. The fact that the control measures been put in place by the Ugandan government, WHO, and other partners have worked so well is a positive thing. Having the vaccines ready to go gave us a massive contingency plan if that had not worked out. But we do need to increase the speed at which we can get clinical material, clinical vaccines to the field. But that's, I think, the challenge, Anna Maria, moving forward, is to really work with our partners. And we again like to recognize our partners in Sabin Vaccine Institute, the Oxford Vaccine Institute, SII in India, the BARDA in the US, our colleagues in CEPI and Gavi, and most importantly, our colleagues in Uganda and the leadership of the Ministry of Health and Bruce Karunga as the principal investigator down there, and all of the people who work with the R&D Blueprint for Epidemics. This has been a really solid, positive, transparent collaboration in which we've got important material to the field in time to make a difference if it was needed. And I think it's a roadmap for the future collaboration in this space. And I'm really increasing our capacity to get effective vaccines into the field quickly in the case of rapidly developing epidemics.
My question, there are two questions. One is regarding the spread of the XBB 1.5 variant, subvariant. This is considered to be a very rapidly spreading variant of Omicron and considered to be evasive to vaccine. This is actually creating fear and apprehensions. So could you please clarify on this? And second thing about the spread of COVID-19 in China, about the data sharing. Dr. Tedros has mentioned about the China has started sharing the data, but WHO still expects a more rapid and check and the data sharing. So could you please share that in the next executive board meeting, will there be some consideration and expectations on that?
Happy New Year to all of you. So with regards to the first question in this XBB.1.5, so this is a sublineage of XBB, which is a recombinant of two BA.2 sublineages. XBB.1.5 has been detected in 29 countries so far. There may be more as sequencing becomes less and less available at a global level. It's difficult for us to track each of these subvariants of Omicron. So it is part of Omicron, and as you've noted, it is the most transmissible subvariant that has been detected yet. The reason for this are the mutations that are within this recombinant, this subvariant of Omicron, allowing this virus to adhere to the cell and replicate easily. And we are concerned about its growth advantage. In particular, in some countries in Europe and in the US, in North America, particularly the northeast part of the United States, where XBB.1.5 has rapidly replaced other circulating variants. Our technical advisory group for virus evolution discussed this yesterday at their call, which was really focused on the circulation of SARS-CoV-2 in China. But we did discuss this subvariant in particular because it is rapidly replacing other subvariants in some countries. Our concern is how transmissible it is. It does have immune escape like we've seen with XBB, but it is another subvariant of Omicron that is in circulation. And the more this virus circulates, the more opportunities it will have to change. We do expect further waves of infection around the world, but that doesn't have to translate into further waves of death because our countermeasures continue to work. So that is something that is on our radar. The Technical Advisory Group for Virus Evolution is doing a risk assessment specifically on this subvariant, which we hope to publish in the next couple of days. But what we can say is that it does have a growth advantage above all of the other subvariants so far. We don't have any data on severity yet or on the clinical picture, but we also do not have an indication that severity has changed with XBB.1.5. But that is something that we are watching very closely through studies and experimental studies in the lab, but also in real world data when we look at hospitalization rates around the world among people who are infected with this subvariant. So it is a risk assessment that will be coming out in the coming days by our Technical Advisory Group for Virus Evolution. I do want to take a moment to say how important it is to continue surveillance for COVID-19 around the world so that we can track these known subvariants that are in circulation, that they can be assessed, that we can understand the epidemiologic picture around the world. We've had, more than 13 million cases reported to WHO in the last month, and we know that that's an underestimate because surveillance has declined. Plus, we've had the holiday period. But more concerning, we've had a 15% increase in deaths in the last month. And again, we know that that is an underestimate because there's delays in reporting. And with the holiday period and with mixing, those trends are expected to continue. So it's really critical that surveillance continues, that we can track the known variants and that we can better assess, what is happening globally. With regards to circulation of variants in China, I should mention the Technical Advisory Group for Virus Evolution just released a statement based on a meeting that we had yesterday, looking at circulation of SARS-CoV-2 in China. From the data that was presented to us from China CDC, of the sequencing that has been done in the country, most of the viruses that are circulating in China are BA.5 sublineages. But again, we need more information on sequencing around the country, those sequences to be shared with publicly available databases like GISAID so that deeper analyses can be done. It's not just a matter of knowing what variants are circulating. We need the global community to assess these, to look at mutation by mutation to determine if any of these are new variants that are circulating in China, but also around the world. So there's a lot more work that needs to be done. There's a lot more data that needs to be shared from China, but additionally around the world so that we can track this pandemic as we enter this fourth year of this pandemic.
With regard to engagement with colleagues in China, we also had a meeting with high-level officials from China last week, and we thank Deputy Minister Gao from the Ministry of Health and also the Vice Administrator from the National Disease Control Authority and Director General of China CDC, with many colleagues who engaged with us on that. Maria has spoken to the TAG VE and also the clinical network meeting. There will be a meeting, a briefing of our missions, the WHO member states, tomorrow, and colleagues from China will also join that. It's an overall briefing on the COVID situation globally as outlined by the DG, including very much the Northern Hemisphere situation, but there will also be specific update on the COVID situation in China. So we thank Chinese colleagues for that engagement. However, as the DG has said, we still do not have complete data. There are certainly issues in terms of the criteria for recording and reporting deaths attributable to COVID-19. We believe that definition is too narrow, which requires respiratory failure in association with COVID-19 to be registered as a COVID-related death. That is a very narrow definition. We know there are difficulties in all countries very often in recording hospital-related admissions and use of ICU facilities. But again, we believe that the current numbers being published from China underrepresent the true impact of the disease in terms of hospital admissions, in terms of ICU admissions, and particularly in terms of deaths. And we would like to see more data on a more geographic basis across China, and we'll continue to endeavour, and we look forward to getting more information on that from our colleagues. We are pleased that more data on sequencing is being uploaded, and certainly getting more information from expert clinicians in China was very helpful for us to understand the clinical impact of the disease and the needs of the system. I do think, though, it's again worth reflecting, because there are sort of two lessons emerging from what we're seeing over the last number of weeks. One is, even if you have existing subvariants causing your problem, if you have not good surveillance, then you're late to understand the problem in terms of its evolution or impact. If you've got less than optimal vaccine coverage, you have more people likely to get very sick. And if your health system is not constantly ready and adapted to surge, then you struggle when that surge comes. And I think China is a good example, as many other situations and countries have been over the last 2 years. It's not rocket science. This is how COVID does its damage now. Poor surveillance, if you don't have good surveillance, good vaccine coverage, and a high level of health systems readiness and resilience, you're likely to suffer in subsequent waves of disease as immunity wanes or as new variants or subvariants emerge. And again, we see with XBB the constant threat of the evolution or emergence of further subvariants that may have characteristics that allow the disease to transmit more easily or to reinfect individuals previously infected or protected by vaccination. So it's very important. And also with specific reference to China, I referred to the issue of under-recording or under-reporting in terms of definitions. It's also very important, and this is a general message to the world, but a specific message in relation to China as well, that we do not discourage doctors and nurses reporting on these deaths or these cases, and that we have an open approach to be able to record the actual impact of the disease in society so that we can take the best action on behalf of our citizens around the world. And this is something in which every country has a stake. But we do recognize the increased engagement from China over the last number of weeks, and specifically over the last 10 days. And we look forward to receiving more comprehensive data through the process of the meetings that we're engaged in over the coming days.
On China, the EU has offered to donate mRNA vaccines. Should the Chinese seriously consider accepting those? And then on XBB 1.5, there have been some reports that in the northeast of the US, hospitalizations are rising. Can we read anything into that on severity? I know Maria said that at the moment the data wasn't there, but is that why they are really concerned?
Well, a couple of things to say about the vaccines. First of all, as we know from China reporting, there are very high coverage levels of vaccination in China. And there are a number of products available in China. Most of them are inactivated vaccines. The big issue is whether or not those who are at highest risk of serious disease have had already the optimal protection from the vaccines that are available. And as reported by China, especially in the over 80-year-old age group, the coverage is not at the level that that would be as high as it could possibly be. So there are very considerable efforts going on now to try to enhance that coverage. What's really important is that the vaccines, both the inactivated vaccines and the viral vector vaccines, the mRNA vaccines, are all vaccines that have had demonstrated high performance of protection against the severe end of the disease spectrum, hospitalization, severe disease, and death, when they're administered in a schedule that includes a booster dose. So the availability of supply is a key issue, and there is ample supply available. So this is really about getting vaccination to people who are not yet fully vaccinated, and especially to those who have not yet had their booster dose, but have had their primary series doses. The choice of vaccine and the choice of the vaccine product, many countries have a mix of products in their schedule, and we do have recommendations about the use of mix and match schedules as well, when you can have some doses from one product and some doses from another product. So certainly a policy decision is really the remit of every country about what the mix of products is that they want to have available in the country for providing the broadest and greatest uptake of vaccine across the population. So I just really want to emphasize that the performance of the vaccines is something that we track really carefully. And one of the issues that we do have is with the new variants that are or the subvariants of Omicron that are circulating, of course, we don't at this point have information about the performance of the vaccines with the subvariants that are circulating. We don't have a specific reason to believe that they would perform in any different way from the other subvariants of Omicron that are circulating right now. But what's clear from that information is that getting the booster dose is one of the most critical things that people can do. And again, especially just reemphasizing what the Director General said in his opening remarks, this is particularly important for those who are at greatest risk. And that's the group that we're most concerned about, especially in situations where there's very broad, widespread transmission of the virus. Thanks.
So we don't have data specifically on severity related to XBB.1.5. And we do note, however, that there is increasing hospitalizations have been reported in the northeast part of the U.S., where approximately 70% or so, I should check the exact data, of sequences that are available from that part of the country are XBB.1.5. What you have to also note is that there are many other respiratory viruses that are in circulation, not just COVID-19 that is increasing around the world. We've just had the holidays, so many people came together, and so we expect transmission to increase. That will result in increasing hospitalizations. We do also have influenza that is in circulation and other pathogens that are in circulation. So we can't attribute the increase in hospitalizations to XBB.1.5 yet, but we are working with US CDC colleagues closely, and we have asked them for a detailed risk assessment of XBB.1.5 as well, just as we would with any country and any subvariants that are circulating. We need to go deeper and look at the reasons for the increases in hospitalization and determine what is happening. I will reiterate what Kate just said with regards to the vaccine. This is true for everywhere around the world. Vaccination remains absolutely critical to preventing severe disease and death, no matter where you live. So if you are out there and you are required to have, if you are recommended to have a further dose, a booster dose, particularly if you are of older age, I'm talking to my friends and family who live in the northeast of the US and everywhere around the world, please get that next dose. It really matters when you received your last dose, especially if you are in that at-risk group. If you're over 60, if you have underlying conditions, and of course we want our frontline workers fully protected. So vaccination remains absolutely critical. But further risk assessments of XBB.1.5 will be forthcoming. It will take some time for some of this information to become available, and we do expect more information to come from the US on this particular variant where it's most notably reported. But remember, this variant has been detected in a number of countries around the world, so it's important that this assessment is done using all available data that we can get our hands on.
2 minutes before 8 o'clock, beginye-ke inhlangano kamhlaba yetempilo leyo bekunabochwephesha laba basiniketa nje the latest on i-COVID-19 kanye naletinye tifo letikhungetse umhlaba. Bayasexwayisa-ke ukuthi siqhubeke sithi phephise kule sifo ikakhulukazi labo lesabavele bajovile bahambe bayothola ama-booster shots ngoba kwangathi isimo sawo lomkhuhlane sifuna kubuya emaveni lamaningi. Sibakhulu ukuthi buye nasi nomhla ekuseni sethemba thina nesuku loluhle nisale kahle sinibona kusasa.
Viewers, welcome to the program Dase Palamende. Lolu hlelo lapho khona sikulethela